Good afternoon and welcome once again in the sixth session of our anatomy of upper limb. Yes, good afternoon. So see, now today is the osteology day. We'll be talking about bones, right? So clavicle, scapula, plus we shall also be taking the upper part of humerus. Right? This will give you a very nice understanding. So that will be upper part of humerus, and this will give you very nice understanding about whatever you have learned till this point. Even if there will be any doubt, right, all those doubts will be completely clarified because you'll be able to see that all those muscles which we were talking, you were watching the muscles, but today you'll be able to see the attachments, right, from where are they going. And as per our basic principle, we'll start with something which we already know, right? So here it is. All these bones, they are well known to you, but what we'll do is we'll add something to this. Say cervical vertebrae, right? So we'll start counting in a reverse way. So we'll say that, well, this is, say here is the rib, right? That's a rib. So if the rib is there, so that means this one is T1, right? So all above, that would be C7, this would be C6, that would be C5, and this is C4. This gives us the idea that yes, that brachial plexus, it was going like this, right? That was going like this. Okay, clavicle, well known to you. The topmost portion which you were feeling, right? That is very right. That is acromion process. And the lateral most bony projection which you were feeling yesterday, right? Lateral most. So that was greater tubercle. Right? Okay. Then that's the coracoid process. Coracoid process. Right? All these are parts of scapula. And yes, we can really see in this is the glenoidal cavity, which is shallow. And right from the beginning, we are talking about that in case of upper limb, right? In case of upper limb, yeah, good afternoon. In case of upper limb, the mobility is more important as compared to the stability, right? So that's why here is the shallow glenoid and against the big head of humerus, right? So that there is large amount of movement which is possible. Okay, and this ridge which we can see, that is nothing but it is intertubercular sulcus, and as it also known as the structure which is passing through it, so it is also called as the bicipital groove, right? Long head of biceps. Perfect, right? So, and this one is the shaft. This is just a basic review about what are the bones which we are watching, right? This would be obviously manubrium, sternum, that also will come into picture. Okay, let's move further. Here it is. We start with clavicle. Now see, in clavicle, this is okay. We'll be studying clavicle, scapula, humerus, and in future even other bones will also come. But whenever it comes to long bones, right? Whenever it comes to long bones, there is a method to study. One, or let me write it over here. Here, right? So for long bones, first the side determination. Why this is needed? Because you should know its importance. It will come in the forensics. You start getting a piece of bone, right? And the entire body has been destroyed, and you come up with a small piece of bone. And just by the look of it, you come to know which bone it is, which side it is, and then with the help of ossification, something which we'll be learning in more detail when we'll be studying about the forensics medicine. So in that we also come to know that how the bone is decomposed, or what's the nature of this bone, right? Whether it is ossified, not ossified. So from that you can even guess the age of that particular body. In case if the body is complete, so you can take few x-rays. So in that case we'll see it in the light of, say, ossification plus the radiology part, right? But over here we'll be focusing on three main things. One, which side it is, that is first thing. Second, the parts of the bone. Now actually these parts, right, sometimes we feel it is so boring, right, telling about that there is superior surface and inferior surface and anterior border and posterior border. Why is such a complex thing? We'll try to simplify this thing. We'll understand it that way, that bone has been formed into that shape because of some purpose. There has to be a purpose, and the purpose would be that this bone is doing what? You'll be surprised that every bone in the body is because of that specific shape, simply as it is carrying some specific function. So when we'll keep on comparing it with it, it becomes much easier, right? So we'll see the parts of the bones, but back to back we'll also see that their attachments. So it would happen like that. Let's say we are discussing clavicle, right? So in clavicle there will be series of images. There will be series of images. Sometimes we'll keep on adding one after the another component into that. But idea is it should form the whole picture. Think about it, right? Without showing any image, I'm just asking you for one thing. Close your eyes and can you imagine levator scapulae, rhomboidus major, rhomboidus minor, sorry, levator scapulae, rhomboidus major, right? In between rhomboidus minor, can you imagine those muscles? Where were they, right? Yes, you're right, right? They were something like this, right? That's how, right, they were getting formed, right? They were those muscles which we saw in the back, right? And then we said that yes, that's the scapula. That's the, in fact, it is like this, right? That's the scapula. So that's where, and here was the levator scapulae. That was rhomboidus minor and the rhomboidus major. That's how they were connected, right? So they were of the shape of that rhomboid. And that's why such names they were given, right? It was a big muscle, so rhomboidus major. But so this concept, this entire imagination would be super powerful by the end of today's session. We'll come up with some ideas so that you don't have to cram anything, right? So let's start. First, as we saw that clavicle, right? We are watching. Always keep an eye on this, that which view are you watching. So this is the anterior view. We are watching someone's clavicle from its anterior aspect, right? We are not watching our clavicle, we are watching someone's clavicle, right, who is in front of us, and we are watching his right side. Got it? Okay. So in its anatomical position. So in its anatomical position, in the first session, we said that when the person is standing straight. Now, right now, we'll just talk with the reference of clavicle, right? With his both arms on its side. Okay. Now over here, clavicle, which Latin meaning is small key. Yeah, well, it looks like a small key. But say in key, the interesting part is that part which goes inside, right? Inside the lock, it is flat, right? Key is like this, right? It is flat, right? Then these are the levers, right? And then that's the handle. But this part is flat. So over here also, there has to be something like that. Yes, it is like that. And we remember it like this, that lat is flat. Right? Lat is flat. That means that lateral side is flat. Just by the looks of it, it is easy to figure out that this side seems quite flat as compared to this is quite round. We'll be having even more views also, right? But we know this part that this side, it is definitely looks flat. Okay. This is one. So it will give us the idea that, okay, there are two ends. One end is round and second end is flat, and this flat end is lateral. All right. If this is the thing, now this is the clavicle. If this side is flat, this side is flat. So either I can put it like this or I can put it like this, right? So this will not give me the judgment whether it is right or left. But then one more important point. This is grooved inferiorly. It means there are two surfaces. One is the superior surface, second is the inferior surface. One is above, one is below, right? If the inferior surface is grooved, there is a groove. So that means the superior surface is smooth, right? Obviously, when we feel our clavicle, right, the superior surface is what we feel. Yeah, that is quite smooth, right? But it is the inferior surface where there will be some muscle attachments, right? Which muscles? Don't worry, we'll see. But just think of, if you can figure out what is above, what is below, and what is right and what is left, then it is easy to figure out, right? Simply by these 2 points, you can very well say that this particular bone is left or right, right? So superior, when we say that this side, this is lateral, right? Because lateral is flat, this is superior, this is inferior, and this one is medial, right? Well, now that this much is sufficient, it means if this is the body, right? If this is the body, so I'll just put it like this, right? This is lateral, this is medial, and as we are watching the person who is in front of us, so this would be the right side. So that's why we are watching the right side of the clavicle. Now there is one more interesting point. The curves meet medially, right? Curves meet medially. How come? Now this bone, do you remember we said that this is an S-shaped bone, S-shaped bone, true? So there are two curves. These are the curves and the joint of the curve, that is the weakest portion from where the clavicle can really break, especially fall on that outstretched hand. So because that is the point where the pressures are getting transmitted. So that becomes the weakest point from where it can really break. Watch here. Here, what we are watching is that point. The curves meet medially. So here is this is a curve and this is a curve, and that they meet medially, right? So this gives a graceful curve, a graceful curve. I think someone asked about that clavicle is also called as the beauty bone. Well, I know you must be watching, right, all those ramp walks and those models, right? But you must have noticed that all those models, right, their clavicles, they are very prominent. True, right? Don't go for further in that imagination, but those clavicles, right, they are like this because those curves, right, those clavicles, they show that entire curve medially, right? And then it goes, say, that's for the lateral side. Okay, fine. One more thing in this case, that when we say clavicle, one prominence is what you really watch. This one, right? This prominence. This is what is called as the conoid tubercle. And this is conoid tubercle. What is attached? Well, something which is cone shaped must be attached, right? You might have even guessed it because we talked in past about it, but no worries, right? We'll come to that. But this is a prominence, and again, see, this prominence is below, right? It is inferiorly. So this also gives us the idea that which one is superior surface, which one is inferior surface, right? Good. All right, moving further. Now there are few peculiarities, few specialities, and these specialities are, say, it's a horizontal bone, right? Horizontal long bone. almost all the bones, in fact, all the long bones, they are all vertical, right? Whether you take it humerus, radius ulna, femur, tibia, fibula, right? All are vertical. This is the bone which is horizontal. Yes, why it has to be horizontal? Well, simple. It is transmitting the pressure from periphery to the axial skeleton, right? To the axial skeleton. So there is a complete path, that is when you are lifting the weight, it goes from the wrist to elbow to your shoulder, and then from there it is the clavicle which is transmitting it to the axial skeleton. So that is one very important point. This is the reason why it breaks, because when there is immediate more pressure, it breaks. This particular bone breaks at that particular junction where the two curves meet. Okay. The next one is subcutaneous. No description is needed for that, right? We have talked enough about, especially that medially that it meets. Okay. And the first bone to ossify. This is important. This is the first bone to ossify. Now you know that these bones, right? All the bones, there are ossification centers. There are ossification centers. Right now, we are not entering into the details of ossification, else the entire session will go into that. But at the end of today's session, I would like to ask you a few questions. So we'll talk about at the end of the session, right? In simple words, I just want to ask you about that what's called as the general anatomy, right? Some general anatomy questions. That do you really need those sessions? So then we can even plan for that, right? General anatomy sessions. But well, at the end of our today's session. First, let's focus to our today's topic. So this is the first bone to ossify, and you must have guessed that in ossification there are several types, but this is the membranous ossification, right? One by one, like those membranes. So this bone actually grows, right? It grows. Membranous ossification. And whenever we talk about ossification, there are primary ossification centers and secondary ossification centers. Because see, these bones, they are cartilaginous, right? They develop in those tuklas, and then gradually they become ossified, and then they start joining with each other. And this entire process is so vital, because with the help of this, the age determination is possible. You are into forensics and you come across a body comes into your lab, and just by looks of it, it is not easy to figure out the age, but you take few x-rays, you come to know that what's the age of this particular gentleman, right? So two primary centers of ossification, will talk about this, right? There is no medullary cavity. This is speciality of every long bone. There is cortex, and inside there is medulla, but this is a bone in which there is no medullary cavity, right? No medullary cavity. This is just a rock solid. This is just a bone, right? And this is pierced by middle supraclavicular nerve. Well, this is worth remembering because it is easy to forget, right? So do remember that. Regarding the ossification center, let's create some space over here. Right? As we said that there are primary and secondary ossification centers, right? And especially in this case, so there are two primary centers. Now those two primary centers, right, they are somewhere in the shaft, over here, right? These are the primary ossification centers. Now there is always a time associated with these ossification center, that is at what age it develops. So in this case, say for this primary, this is 5th to 6th week of intrauterine life, and they fuse on 45th day, right? So quite early, right? They just fuse. But then those secondary ossification center, which I'm drawing, right? This is secondary ossification center. This secondary ossification center, see how important can it be? This will be even developing, right? It will appear after 15 to 17 years. And then by the time person reaches to the age of 21 to 22 years, they fuse. So it means up to the age of 21, 22, this piece is separate from the shaft, right? This piece is separate. So, so all of you, those who are, let's say, 18 years, 19 years, 20 years, right? If the X-ray is taken, you will find that this end is medial or lateral, right? We said lat is flat. This is the lateral end, right? So if the medial end is seen, so your bones would appear something like this, that this is the shaft, and then there would be a space, and then there is a bone. It would look like this. So just by look at it, immediately you know that this is a young person, right? By the time you reach to the age of 22, this thing would fuse, and then it is just one complete clavicle. In some cases, you might see one more ossification center, secondary ossification center over here, right? That is on the lateral aspect, but not in every case it is seen, sometimes. All right. Now let's see the bone with different perspectives, right? This will make things much, much interesting. Say when you are writing some report, you just can't say that, okay, clavicles this end and that end. Say, we can't see each other. It is only the written note, right? So in this, you'll always say that one end is acromial and this end is sternal end, right? Makes sense because this is lateral and this is medial, right? And in between we call this body. Good, easy. Let's see further. Now when you are watching, this is anterior view, right? Remember, this is anterior view. You are watching the anteriorly. So any edge, that border, which is exactly in front of you, it has to be anterior border. And if it is anterior border, then anything which is above it, it is superior surface. Anything which is below is the inferior surface. So that's your, that's your superior surface, and this one is inferior surface, right? So in simple way, we can just make it something like this, right? Like this. So that one is superior, this one is inferior, and that becomes the border. Okay, let's see further. So here we are now adding those points where some special names are given. And those special names are, one, this is a medial end. Yes, we have talked about it. This is a medial end, and medial end will be in association with sternum. So there has to be a sternal facet, a face which is meant for the sternum, because here it would be in articulation with the sternum, right? Sternum, center one. So that's why it is called a sternal facet. So whenever you'll be describing the joints, right, you'll talk about these portions. Here is the acromial facet. Yes, because it is in process connection with the acromion process, right? That one, top one, acromion, which is at the top. And here is, we were discussing conoid tubercle, right? So that's a name. And then there is a trapezoid line, right? Trapezoid line. Why there has to be a line? Because such a powerful muscle will be connected. And this muscle is our, that favorite nice muscle, traps, right? Okay. Now, again, this is the anterior view. Here, we are watching it exactly from anteriorly. So it means we are dealing with what? We are dealing with the anterior border, correct? That's the anterior border. And when we see that, yes, it is the pectoralis major, obviously, right? No doubt about it. It is the pectoralis major, because remember, pectoralis major we'll see even more also, but in pectoralis major, all the way from manubrium sterni to the, see, this is what, this is the medial end, this is the lateral end, and we said that it is the medial 2/3 which is covered by the pectoralis major. Yeah, it is almost 2/3, right? That is what is covered by pectoralis major, and then the pectoralis major will take turn like this, right? And then it will be connected. Here is the deltoid which will be connected, and then it will be forming the that curve of the shoulder, right? So that's like deltoid clavicular part. So these are the two major big muscles which are connected to this clavicle. Let's see further. Now we are watching the posterior view, right? Watch, this is now posterior view, right? This conoid tubercle, this conoid tubercle is also giving us the idea, right? You see, over here, conoid tubercle is laterally situated. So when we are watching from the posterior aspect, this is lateral, right? This is lateral. This is medial. Yeah, this is rounded and this is quite flat. So that's fine, right? Let's add something extra to this. So here it is. This is the acromion end. Yes, that's the acromion end. And this one, right? This smooth thing, this one, that would be the acromial facet, correct? That's the body, that's simple. And this one is the rounded sternal end, the medial end. Remember, you are watching from the posterior aspect, right? We are watching from the posterior aspect. It means you have taken the clavicle out and then you are watching from the back. Okay. So when you are watching from the back, this logic is much easier. When we were watching it from anteriorly, we were watching anterior border, superior surface, inferior surface. Same thing, because it is from the back side. So now we are watching posterior border, and obviously this would be superior surface and this would be the inferior surface, right? This is conoid tubercle, and this is the entire body or the shaft of the clavicle. Let's see further. Adding something extra. What we are adding? Immediately, first thing which I would like to see is that small cute subclavius, right? This is the subclavius. So here it is. This is the groove for subclavius, because this is a small, very neglected, cute muscle, right? And now the moment I say subclavius, so now to subclavius, and you must remember that now to subclavius was arising from, right? You should answer, right? Okay. So this is acromial facet, that is the sternal facet, and this is costoclavicular ligament. Costoclavicular ligament. Costoclavicular, right? That means costa means this is about ribs, right? So yeah, it is with rib and the clavicle, right? That would be attached. So thus it gives stability, right? This would be the conoid tubercle. Okay. Let's see some muscles. Here it is. Yes, that's the subclavius, right? First muscle, right? So why should we ignore such a small muscle, but very important, right? It gives stability and it gives support to brachial plexus and the axillary vessels, correct? Now the trapezius. For trapezius, it was like this. And trapezius, yes, that's right, superior trunk. And for trapezius, we said that there are three types of fibers. True? Descending, transverse, ascending. which fibers are which. Will transverse, so it is easy, right? They are transverse, but we'll always be considering from the center. So that's why the descending fibers, they are like this. Ascending fibers, they are like this. And now put the clavicle in between, right? So when I put the clavicle over here, so it means those descending fibers will be landing on the clavicle. That's what we see it over here. So trapezius, those descending fibers, they will be landing over here. So done, trapezius done, subclavius, sorry, done. And one more muscle, this one, sternocleidomastoid, right? Sternocleidomastoid. Though this is a muscle of neck, but because it is, everything is connected, right? Everything is connected. So sternum and clavicle. And mastoid process is just behind the ear, that prominent process, mastoid process. So when you take your neck on one side, the entire muscle, right, which is coming in the neck, right, the entire muscle, which you watch it like this, that's what is called as the sternocleidomastoid. Very important muscle, because actually your neck movement, right, that plays a major role. Now this muscle, it has got two heads, right? It has got two heads, because name itself is telling sternocleido and the mastoid. So mastoid, so it is done over here, and that is the mastoid process. But over here on the lower side, we have got the sternal head and we have got the clavicular head, or the clavicle, or the clavicular head. Yeah. So sternal, clavicle and the mastoid. That's why the name sternoclavicular. Clavicle is cleido and the mastoid, right? So that small one, this small area, this is what is dedicated to sternocleidomastoid. Again, this is a very small muscle, sternohyoid, but again, as they are part of head and neck, so we just remember at this point of time, just keep in mind that it is sternohyoid which is connected over here. To make our understanding still more powerful, we are now watching it exactly from the top, right? We are watching it from the top. So again, you have taken the clavicle out of that person, and then this is like you have deployed a drone, and then from top you are watching it. This is like a bird's view, right? This is like a bird's view. You are watching it exactly from the top, because that way you'll be able to figure out that which muscles are connected. Okay, so that's easy, right? No further description needed. That there is a sternal end, there is acromial end, this is a lateral end, and lat is flat, and that's why this is a flat end. Okay, and this is the body. Good, let's move, right? And yes, this makes our understanding still better, because when we were watching it from anterior side, we were watching anterior border, and then there was superior surface, inferior surface, but now we are watching it from the top. So obviously the superior surface would be the guest of honor, right? And anterior border, obviously anteriorly, posterior border, obviously posteriorly, right? So this part is good. Okay, here it is, that who is connected. The muscles of the neck, here it is, the sternocleidomastoid, because it is going straight away into the neck, so it has to be onto the superior surface. Done, right? This is the sternocleidomastoid. And then see the trapezius. Trapezius is a muscle which is attached on the back side, right? It is on the back. So very nice. This is trapezius, but these are the descending fibers. Yes, it has to be descending, because clavicle is somewhere over here, and they land, these muscles, they land over here, right? So descending fibers, they are landing. And on the anterior side, there is deltoid, right? Now you know that deltoid, why I am writing clavicular part. We are writing clavicular part as we know that deltoid is not a single muscle, right? The name is given, but it has got anterior fibers, it has got middle fibers, it has got posterior fibers, and those middle fibers, they are, the word immediately should come when I draw like this, like this, and what is that word, right, which should come in your mind immediately, which is actually giving strength to the muscle, right? And it is multipinnate, right? So it is a multipinnate muscle, that is the middle deltoid. But right now we are dealing with this clavicular part, right? So that's the part, that is the clavicular part, deltoid, right? This is what we are watching as we watch it from the superior surface. Okay, now next is, say, this is the inferior view. Now if we take, right, if we take this clavicle out and then we watch it underneath, right, we watch it just from underneath, that how it really looks like. See, some points, they are important from the concept of that what it, see, can you see, just let me change the color. Yeah, this portion, right, I'll erase this, then you, right, you appreciate that there is some prominence, right, some roughness, right, there is something rough. So first thing first, we'll see that where is the, that's the lateral end, right, and then there is a medial end. Okay, and over here, this rough surface, that surface is for costoclavicular ligament. So this is medial end. So let me draw, right? Say here is the rib, okay, and then we'll have the manubrium sterni, and then on top of it, let's draw the clavicle, and we draw the clavicle like this, right? So here is our costoclavicular, this one, right? So that's why we said costa is rib, clavicle is clavicle, and this is the costoclavicular ligament. Here it is. So that's how it is attached. And as this prominence, it is so much prominent, right? You can literally see that, yes, there is a rough surface. It means this is very powerful, right? This is very strong ligament. So whenever it creates a very clear impression on the bone, that means those muscles, they are powerful. So this is one of the method to figure out whether this bone is a male bone or female bone, right? Because in case of male, due to testosterone, the muscle strength is much more, right? Muscle strength. It's not so that if the female is an athlete one, so even her muscles would be strong. But in general, the muscles of the male, they are strength wise, right? They are more. So that's why the bones of the males, you'll find that there are very strong serrations, or there are very strong impressions found on the bone. Okay. Again, sternal end, acromial end, this sternal end, I'm repeating again and again, sternal end, right? Sternal end. Lat is flat, so lateral is flat. So this is the lateral end, that is the acromial end. This will be the rounded end, right? So that is the sternal end. Rest is all body. All right, good. Move further. No problems, right? Same way, now this was the bone. Now we are watching it from below. So obviously the inferior surface, it is in view, right? And over here it is the posterior border. Here is the anterior border, because we are just watching from below, right? So as we see that what is connected to that, well, sternal end, this is the sternal end, so this is the medial end, right? This is the medial end. But this conoid tubercle, yes, it was near the lateral end, right? So that's the lateral end. That's the conoid tubercle. This is the trapezoid line, right? Trapezoid line, a strong impression. And we said in the identification that the lower surface is grooved. That lower surface is grooved because thanks to that our small but cute muscle subclavius. So it is creating that groove. So this is the reason why it is grooved. Also on this side there is costoclavicular ligament, and over here it is the trapezoid. So it is the joint operation of costoclavicular ligament, subclavius and the trapezius that the lower surface is grooved. So that gives us the lower surface. And when we see which muscles are connected, well, that's like this, right? Subclavius, no doubt about it. And over here, right, the deltoid, right? But deltoid is as such, we saw that it can be seen on the outer side. And here is the pectoralis major because bigger muscle, so it is taking that entire surface. Let's move on to the scapula, right? Now in scapula, how much we have learnt? Well, we know this is the acromion process. That part we know. This is the coracoid process. That also we know. This is glenoid surface, right? That's the whole body, right? That's the body. And identification is very easy, right? In case of scapula. As we know that spine is always posterior. Spine is posterior, right? And this glenoid is always laterally because humerus would be connected. But these 2 points, they are more than enough to figure out whether it is right side or left side, right? No confusions, no worries at all. So just by the look, we see that this body, it is smooth. So that's the anterior surface, right? This one is the anterior surface. All right. And this is facing laterally. And what we are watching is this person is standing in front of us. So he is standing in front of us. Yes, he will be having the arm over here, right? His second scapula, right, on the opposite side scapula will be here, and here would be his second arm. And because he is standing in front of us, this is his nose, right? These are his eyes. He is going to curse us for drawing such a cartoon, right? But we know, we'll say, when we say hello to him, so he'll give this hand for hello. So that means this is right side, correct? This is the right side, right? So hello. The names already we know that. Acromion process, right? That's the coracoid process. That's the head. If this is the head, then that would be the neck. And this is the body, right? Explaining bit more. So this is a triangular bone, right? This is a triangular bone. When the bone is triangular, so it means it has got several angles. So one angle, this makes complete sense that this is inferior angle, no doubt. If this is inferior, so there has to be superior. So yes, this is superior angle, right? And this one would be the lateral angle. So done, right? This is superior angle, inferior angle, and the lateral angle makes complete sense. This is the lateral border, right? Lateral border. So here it would be the medial border. As the scapula is arranged like this, right, in the back of the body, so we'll call this border as the superior border. So here is the superior border, that one is the medial border, this one is the lateral border, this is the lateral angle, this would be superior angle, and this would be the inferior angle. True? This is costal surface. Yes, because it will be in association with costas, right? That is the ribs. So now, clavicular facet of acromion. Yes, exactly. Exactly. This is clavicular facet, right? I'll just zoom it, and here it is, right? That's where the clavicle would be connected. So this will form a joint. So that is acromioclavicular joint, and this is the facet for clavicle. Then this one here, it is the supraglenoid, because this is glenoid, right? That's the glenoid, and above it is the supraglenoid, below it would be the infraglenoid, right? And we know what is connected, right? What is connected over there? Yes, you are right. Supraglenoid, it is the biceps long tendon, right? Long tendon, right? Long head of biceps, and the infraglenoid is the triceps long head. Yes, they are called long head because they have to travel all the way to reach just inside this capsule and then make a connection, right? So this is biceps, triceps, supraglenoid and infraglenoid. That's infraglenoid. This is subscapular fossa. Nothing, no description is needed because you know it that it is our favorite subscapularis muscle which is connected over here, right? Now there is inferior scapular notch. I'll show you this notch from even other angle also. But meantime, if you remember last time we talked about that there is suprascapular notch. That suprascapular notch which is converted into suprascapular foramen. And why we need to remember it? Because army is above and navy goes below, right? Navy goes below. So army means this was suprascapular artery which was passing above. So let's draw this thing as red. Artery was above and the suprascapular nerve was passing underneath, right? This is what is the suprascapular notch. That's right, right? So let's see these muscles. You try to identify how many muscles you can really figure out that which muscle is which. Well, no marks if you just say this is subscapularis. Yes, you should know that, right? So this is the easiest thing. But as we always start with something which is easiest. So this is, say, subscapularis. Okay, good. Now watch, this is anterior side or posterior side? Yeah, it is anterior, right? It is anterior. As such, it is a costal surface. So when it is a costal surface, think of what could it be, this blue line, right? Let me zoom, right? Now you should be able to see this. I'm talking about this line, this line, this line. This is that important muscle. If anything goes wrong, right, then person will become a bird, right? I'm giving you a hint, right? If anything goes wrong to this muscle, that person becomes a bird, right? Well, with those wings, he won't be able to fly, but still he'll be having something called winging. So what I'm talking about, right? Which muscle I'm talking about? Yeah, that's right. This is serratus anterior, exactly. And how many slips were there for the serratus anterior? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. How many? How many slips were there for serratus anterior? Right? 8. That's right. Good one. Right? So there were 8 slips which were associated with serratus anterior. Okay. This is Acromion process. This is coracoid process. Let's talk about this very important point, right? Just the tip of coracoid process. I would like to break this thing into 2 parts, right? I'll be very happy if you can identify what is connected above and what is connected below, because both of them, they are on the, this is technically called as apex, Correct? This is apex of coracoid process. On apex of coracoid process, two muscles are connected. We talked about, yeah, very good. We talked about that these muscles, there is one muscle and other muscle is just underneath that muscle. Both of them will be landing on coracoid process. Who was above? Who was below? Right? Which muscle are we talking about? I'll wait for the answers. Right? Let's see. Which muscles they are connected at the apex of coracoid process, superficial who and below who. Well, Daksh, remember, this is the catch. I'm talking about apex. Chalo, I'll make your confusion bit easy, right? I'll tell you said pectoralis minor. Here is pectoralis minor, right? So now that part is done, right? This is pectoralis minor. We are talking about exactly the apex, exactly at the apex. Which muscles are connected on the apex? And you know the answer. Short head of biceps and below it is coracobrachialis. Excellent, right? Because you remember we were drawing it like, yes, apex is biceps, right? Anuj, supraspinatus, wait. Supraspinatus, should it be over here on the apex? Supraspinatus, so it is on the back side, right? We'll just watch immediately after that, right? There is a spine, just above the spine, there is supraspinatus, just below the spine, it is infraspinatus, right? Right, this is pretty anterior, right? Because coracoid process is just anterior. That's your acromion, and just if you press, then you'll feel some pain, right? That's the coracoid process, right? Technically speaking, when you want to hit someone, if you give that sharp punch on the coracoid process, it gives lots of pain, right? This is a very sensitive area, right? So one punch, and yes, it can generate large amount of pain. Okay, and no problems, it's fine, right? Don't delete the message, don't worry, that's okay. It is good that you make a mistake. Next time you will never do that, so it is good. Attempt, when you attempt, I am very happy. Okay, so here it is, right? So above we have got the biceps, right? And it is the short head, right? Because long head to we saw, right? Long head to we saw, it is the supraglenoid. And this below, it is the coracobrachialis, right? It is the coracobrachialis because it is going from coracoid process and then it will go on the shaft of the humerus. And remember coracobrachialis because today we'll be introducing one more guest into our muscle group, and it will help us a lot because from next time we'll be starting the arm, right? So we'll introduce few more guests to complete the whole picture. Okay, one more question. This is acromion process, got it, right? This is the acromion process. Any guess what is connected exactly on the acromion process, right? On the acromion process, right? I know you will say deltoid. That's true. It is the deltoid because deltoid is what gives that curvature, right? That curve, right? So no other muscle can actually be over there. So that is the deltoid. Now, say, okay, let's see that thing in next image. It would be much better. So here is the posterior view. The sorry. So this is a posterior view, right? So this is spine, and above spine is supraspinatus, and this is the infraspinatus, but that is supraspinatus, infraspinatus. That is when the muscles are there. Right now there are no muscles, so we'll call them fossa. Right? These are supraspinatus fossa and the infraspinatus fossa. That is the spine. This is acromion. This is coracoid. But we want to add something to this. See, there is one nice angle. Can you see this angle? It is this angle, right? It is this angle because this angle is so good, we would like to give some name to this, right? Because anything before that is acromion and after that it is spine. So let's give the honor to acromion process. This is what is called as the acromial angle, right? Acromial angle. So now it is crystal clear that from where the we'll say acromion and from where we'll say the spine. So here it is, that's the acromion, right? This would be the acromial angle. Here is the head, that's the neck, that's the whole body. This is spine of scapula, right? That is spine of scapula. That's the coracoid process. And this is what we are watching from the posterior side. And just few things. We know this part, right? This is acromion process, this is spine, this is coracoid process. This one, right? That is the neck. This one is the body, right? And the entire dorsal surface. This is the spine. And this one, right over here, this is the inferior angle, right? Inferior angle. And we have got that superior angle. This is the superior angle, and obviously this one would be the lateral angle. But one finest thing which is seen in this case is our gorgeous suprascapular notch. See how nicely it is seen. That is suprascapular notch, right? And this is the notch which would be converted into the suprascapular foramen. And then in that, the artery would be above and the nerve would be below, right? So that's what we'll carry with us, that piece of information from this image, right? Okay. So here is, as we are watching posterior, things becomes much clearer now. That's the acromial angle which we are talking about. This is infraglenoid tubercle, and that infraglenoid tubercle which will be giving connectivity to that long head. You are right. Triceps. Sorry. The infraspinatus and the supraspinatus. Right? Now see, there is inferior scapular notch. This superior though is seen so clearly. Right? The superior is seen so clearly. So there must be two notch. If there are two notch, then and then we'll say that one is superior and one is inferior. Otherwise, we would have said just scapular notch. But there is inferior. Well, is it seen so clearly? Truly speaking, no. Right? Not seen. I have written it over here just to give you the idea that this would be the area. Now, I want you to imagine a bit. That's the scapula, right? On that, okay, let me show it like this. This is the scapula, and then there is the spine. So as the spine emerges, so there would be a curve, right? Because that spine would emerge like this, right? But it is on that curve you get inferior scapular notch. We'll have a good image and good angle where we'll see that. But first, let's talk about some of the very important muscles over here. You see these muscles. Supraspinatus, good, right? No problems, right? They are perfect. So supraspinatus, infraspinatus, that is good, right? First, we'll finish off something which is easier. Long head of triceps, we talked about. And this is giving us very nice concept that here, all the way, right? See, I'm drawing it here, here, and here. So it is in three parts. This is giving a great surface to trapezius. So trapezius has got descending, transverse, and ascending. So this is descending, this is transverse, right? That's the transverse, and this portion, last portion, is the ascending. So that's how the trapezius is connected. Long head of triceps, known to you, right? Now comes teres major and teres minor. This is lateral side, right? And in lateral side, remember what were the muscles which were used for, which were also collectively called as the rotator cuff muscles. Rotator cuff muscles. There were four muscles, right? Four muscles who were forming rotator cuff muscles. And what rotator cuff muscle is? It is the musculotendinous ring which is giving support to the entire shoulder, right? But it is deficient onto its inferior side, lower side. And that's why if the shoulder has to dislocate, it will be more on the downward side, because superior, anterior, posterior, there is a strong muscle. These are, yeah, exactly, it is. In fact, you wrote it very correctly, right? It should be written like, I'm happy, right? It has to be written like SITS, so that you never make a mistake. Very good, very good. Supraspinatus, infraspinatus. This small t is teres minor. Here is our smart teres minor, and the subscapularis. Subscapularis, which would be anterior, and our, say, here it is the supraspinatus, here is our infraspinatus, and it is the teres minor. Now if you look at it, right, so see the supraspinatus is going, infraspinatus is going, teres minor is going, and all of them, they are landing where? All of them, they are landing where, right? It was like they were divided into three parts, right, in a complete series, and the subscapularis was anteriorly, right? So that's how it was making the entire joint so powerful. And here is the bigger one, teres major. Teres major, one question, right? Remember, yes, very good, very, very good. Greater tubercle. Now in teres major, right, just one word answer. One word answer which you'll give. Teres major, something happens, right, at the lower border of teres major. What's that? Something happens, that's the teres major muscle. Something happens at the lower border of teres major. What is that? What is that? What happens at the lower border of teres major? Yes, I am waiting. Something happens. Maybe it is the change of the name. Maybe, right? No more hints. This much is enough. Some change in the name. Before that, you call something else. After that, you call something else. What is that? What we are talking about? What happens at the border, lower border of teres major? Yes, you know it. Okay, what happens at the lateral edge of first rib? What happens? That change in the name. What happens at the lateral border of the first rib? Yeah, exactly. Brachial artery. Yes, it is the brachial artery, right? Because over here it was called as the axillary artery, and from this point onwards we shall call it a brachial artery, right? Brachial artery. And on the lower edge, right, that is the outer edge of first rib, it was the subclavian, whose new name becomes the axillary artery. Exactly. Okay. Now here is the rhomboidus major and rhomboidus minor. For this you have to recollect that image, right? Yes, you have to recollect that image when we were drawing it like this, that if this is the back, right, these are the scapulas, and they were forming those rhomboidus muscles like this, right? They were forming the rhomboidus muscle. I'm sorry, let me draw it again. The angle is incorrect. It has to be like this. Yes, right. So here is those rhomboidus muscle, right? The below was a bigger one and above it was a smaller one. So let's change the color, right? So here was the major, this was the major muscle and the minor muscle, right? Rhomboidus major and rhomboidus minor, they both are present over here. And this one is levator scapulae, elevating the scapula, right? So levator scapula, rhomboidus minor and major. Yes, we'll be watching it again also from different perspective, but that's what we see, that now see suddenly the entire scapula has become so friendly, right? We know that what is on the medial side, what is on the lateral side, and what is on to that spine, because spine is totally committed and dedicated lovingly to trapezius, right? Okay, now this is the angular view, just for one reason only, and that reason is this is the infra, that were previously you were watching suprascapular notch, this is the infrascapular notch, bus, right? That's the infrascapular notch. Otherwise, this is acromion process, coracoid process, this is the glenoid, and that's the body. This one would be the spine, supraspinatus, infraspinatus, right? That is the head and neck, and everything is known to you, right? Everything is fine. True, just with few colors so that you can really watch it with clarity. This is body, that's the inferior angle, that's the superior angle, this one would be the lateral angle, also the, this is the neck, and this one is the lateral angle, right? So acromial angle, yes, we now know it very well, right? Before that, it is acromion process. After that, we'll call it spine. And this area is supraspinatus. This one is infraspinatus. That is what we were talking about. This interesting area, this one is nothing but inferior scapular notch. And that's the inferior or the infraglenoid tubercle. Once again, just to recollect, you know it, and still I am writing. This is about the triceps. As it is traveling such a long distance, let's give it a grace that it is the long head of triceps, right? Its cousin is connected over here, but this cousin is having two heads. So this is the biceps, but he is also traveling. So we'll say this is a long head biceps, right? Okay. So here it is, short head biceps and long head biceps. So long head biceps done, long head triceps done. That is all teres minor, teres major, right? Supraspinatus, infraspinatus, and here it is, right? We just zoom it, and here we can actually see very nicely that how those are, right? Here it is. I'm talking about this portion, right? It is how it is divided into those two parts, and this top one is the biceps short head, and this lower one is the coracobrachialis. True? Okay. Let's move on to the humerus. Once we'll add humerus, the entire game would change, right? Because this time, from this point onwards, I have not written anything. So I'll keep on asking you about several muscles. Try to answer as fast as possible. It would be a great fun. And at the same time, try to reconstruct that how all the muscles they are oriented, because this time we'll be marking the muscles on clavicle, sorry, on the clavicle, on the scapula, and the humerus, right? All on all of them. So let's start, right? You know the drill, that these are all parts, right? That's the acromion process going very fast. This is acromion process, and that's the acromion end. This is the body, this is the coracoid process, right? Neck, glenoid, head, and the bicipital groove, greater tubercle, lesser tubercle, and everything is good. Okay, First, as we are talking about humerus, we'll add something to it so that you are properly oriented into that time and space. This is humerus, right? That's humerus. So when you are watching humerus from the front, right, you'll find that when the hand is like this, right, though this bone is richly covered by the muscles, so we won't be able to feel actually the entire bone, right? We won't be able to feel the way we feel that greater tubercle as the lateral most part. Yeah, that is okay, easy to feel, but not rest of the bone. So this is what you have to imagine, that how it is looking like. The first is that this part, right, it is anterior, so we'll call it enterolateral surface, right? Very carefully understand this. This is enterolateral surface, so in that case this is relatively medial, so we'll call it enteromedial surface, right? So far so good, right? This is enteromedial surface. Now this part, right, this part, though this is looking like this is anterior, but it is a posterior surface, right? Looks tricky. It's simply because the major surface is on the posterior side, only a portion of it is coming on the anterior side. Otherwise, when we'll watch the posterior part, we'll see that it is the entire posterior surface. And then because the bone, right, these bones, they are not geometric bones, right, with exactly cut to cut, right? These are all naturally formed. So that's why a small portion it takes turn and it is just showing up over here. So as such, this portion is a posterior surface, right? Only that small portion. Otherwise, for the entire portion, entire bone, entire shaft, there is enterolateral and enteromedial. So this means that this bone is looking like this: enteromedial, enterolateral, right? That's how the bone is. So it means if I cut this bone in the top, it will be like a triangle, right? It will be like a triangular thing. Its importance, shape, yes, it will come when we'll be studying the arm in depth, right? We'll actually see the cross section, and in that I'll show you even the CT scan, right? That when you take a cross section, how it looks like. When you go at a lower level, how it looks like. Okay, let's see this. Now we are adding something to that. This is for that understanding that even if you strip off all the bones, if you remove the bones, still there are some very important, say, areas which can be defined clearly. Defined clearly. When we say this part, when we say inter tubercular sulcus. Sulcus means depth, valley, right? Space. Intertubercular, name itself is telling. Let's say it is like an inter-college competition. That means there is competition between two colleges. Here we are telling that it is intertubercular sulcus. That means there has to be two tubercle, and those two tubercles, they should be having their crest, right? They should be having their mounts, their prominence. Then and then a valley can be formed. Valley can be formed when there are mountains on both the sides. Simple. So it means there has to be two tubercles, two prominence, and yes, one is greater, second is lesser tubercle, right? So over here, lateral most prominent is greater tubercle, so this one is greater tubercle, right? And I'll write it like this is greater tubercle, right? This is greater tubercle, and it's called as the crest, prominence, ridge, strong ridge, right, which is over here. So one mountain formed, and this opposite side, this is obviously lesser tubercle. And what is that? Lesser tubercle's crest. So crest of lesser tubercle, crest of greater tubercle, and in between the valley which is there, in that valley there would be traveling the great bicipital, right, biceps, that long head of biceps. He'll be traveling all the way, right? See how long he'll be traveling, right? He'll be going all the way, and then through the capsule, and finally will be finishing its journey onto the supraglenoid tubercle. That's why we were telling that yes, he's a long bone, long head. Okay, then this, it is surgical neck, right? It is surgical neck. That surgical neck which is associated with one nerve, and I'll be happy if you can say even the vessel, the blood vessel, the artery which is also associated with the surgical neck of humerus. Which nerve and which artery is associated with surgical neck of humerus? Which nerve and which artery is associated with surgical neck of humerus? Right? You should be able to, yeah. Okay, Akapaka, I think I like that answer. Right? That is good. Right? That is good. And axillary nerve. Right? Axillary nerve is associated with, because see, axillary nerve will be going posteriorly. Right? It will be going posteriorly. So it will be associated with posterior circumflex. That's right. Okay, good. Very good. And here is a monument, right? This is like, this humerus is so happy that powerful muscle, such powerful muscle, right? Deltoid, right? Is deltoid, all the fibers, they are gracefully coming and they are landing over here. So he'll say, ki chalo, in your memory, I'll give this name as deltoid tuberosity, right? He'll give the name that yes, this is a special area given to you, and that is deltoid tuberosity, because you know that all the fibers, right, finally they were into the form of that multi-pinnate fiber, right? And then those four septas, they were converging into three septas, and then they were landing it over here. Okay, deltoid tuberosity. So that's the deltoid tuberosity. Surgical neck, crest, everything done. Here it is. Now everything over here, all muscles, right? This would be a great fun. Let's start with easiest thing. This one. Say, this is subscapularis, right? No problems. Easiest thing. Then this one, we know this, right? It is the short head, biceps, and the coracobrachialis. I'll write it in short, right? And because it is, so then this one, no doubt about it, you'll remember, right? Pectoralis minor, right? Now that is pectoralis minor, done. Okay, this one, right? That's where the deltoid is arising, right? All the way the deltoid is arising. So here is the deltoid, right? Here is the deltoid. So we'll call this thing, this is the clavicular head, right? See how nice, right? This is the clavicular head. So deltoid is arising like this. So deltoid has got clavicular fibers and it has got the acromial fibers, right? So we'll call this part, this part, right? This one, right? This one which I painted white. Now I'll remove this so that you can see it clearly. Yes, exactly. So that is the clavicular head of deltoid, and this is the acromial head of deltoid. And then that gentleman will go all the way to the deltoid tuberosity. Good. Next is over here, this subscapularis, right? If we really want to draw, then this was the shape. This is how it was going, right? You remember this? That's how it was going, right? That was subscapularis. So now immediately the picture is clear, because it is the anterior portion. It is part of that rotator cuff muscle, right? So that rotator cuff muscle anteriorly is supported by subscapularis. So here is the subscapularis. This portion I will not say, right? You know it very well. And that is our smart lats, right? And on both the sides there are majors, right? Majors. And pectoralis major was the first muscle which we learned, and it is on the lateral side. So that's our pect major. And the only one which is left out is teres major. So here it is, pectoralis major and This one is the latissimus dorsi, and that's the teres major. Good. All right. And that pectoralis major, because we are talking about pectoralis major, here is the pectoralis major who is working all the way from here, here, right? That's how it is forming that big surface area. So if I write it over here, pact major, so this is the pectoralis major, this is the pectoralis major, and that's how they get connected. And then it is a fan-shaped muscle who finally reaches to this point, right? Thus giving the whole power. Okay, let's introduce someone here. This one, right? You know who is he? Because he is the person, right? He is who was going all the way to this coracoid process. This was like this, right? This one. And he's that chupa hua muscle just underneath that short head of biceps. Yes, he is coracobrachialis. Now, coracobrachialis is here, but then coracobrachialis has got a friend, right? He's not alone. He has got a friend. And this friend is going to go down, right? And his name is very similar. His name is, welcome to our new guest, and his name is brachialis, a true muscle of arm, right? So whenever there is fight, this brachialis muscle will play a major role, right? Because your brachialis should be strong, right? When we'll be studying, I'll talk about it, right? Okay, right? So this all khichdi now, but it is crystal clear to you that which muscle is what. Here, a combined approach, right? Just from a different angle and just from a different perspective, that we know that this is spine, acromion, and everything good to you, right? Over here, yes, this is the acromion process, and don't forget that acromial angle, acromial angle, that's the greater tubercle, that's the greater tubercle lateral most bony prominence, which we feel that's the head. Head is large relative to glenoid because for mobility, right? And rest is spine, supraspinatus, infraspinatus, all those superior angle, inferior angle, medial border, lateral border, right? All known to you. Good, right? Completely fine. This is what? This is superior surface of clavicle. That's right. This is acromial. This is acromial angle, right? That's the head of humerus. Good. Huh. This is what I was planning to show you. This is the posterior surface. See how big the surface is. So this is posterior surface, right? Let me highlight this one. This one is the posterior surface. See how big it is. And that posterior surface is slightly going on the anterior surface. So that's why, say, doctors thought that why to give a new name and make the confusion. So that's why the small portion which is going on the outside, it is also called as the posterior surface, right? And this one, right, that is anterolateral, yeah, because it is laterally, so it is anterolateral surface. True. Spine, supraspinatus, infraspinatus, superior angle, inferior angle, neck, all known to you. Yes, things are now, this is the surgical neck, right? Surgical neck. But here is our long awaited one more, our royal nerve. That was the radial nerve, right? Long awaited nerve. And we remember, why we remember that this was the posterior cord. Posterior cord was giving that axillary nerve, right? Axillary nerve. But this posterior cord, it gracefully continues as the radial nerve, right? And this radial nerve is big, thick, powerful. It takes turn, it goes onto the posterior compartment. But this humerus is so happy that it gives a special monumental structure, a place for it, and that is the radial groove. Here is the radial groove, much awaited, right? Radial groove. We talked about this radial groove so many times, right? But now we have a look at it. See, this one is the radial groove. This one is the radial groove, right? That's the radial groove. And then what is this? What is this? This is also very important. You know it, right? In the memory of our deltoid, right? So deltoid tuberosity, correct. Rest is all easy. This is spine, supraspinatus, infraspinatus, supraspinatus, infraspinatus. That's the spine. That's the acromion angle, right? That's the acromial angle. This is the acromial process, right? This is what? This is infrascapular notch. This is infraglenoid, right? This is the infraglenoid, and above it will be supraglenoid. Let's see a few muscles, right? Now this would be like a complete orientation, right? Everything would be crystal clear. Everything. This is supraspinatus. This is infraspinatus. No doubt about it. This is teres major. This is that chota, teres minor. And on top of it, right? This muscle, right? Small muscle, supraspinatus, infraspinatus. But then it would be going like with third muscle, that is a long head of triceps, right? There's a long head of triceps. Long head, right? Triceps. Now this long head of tricep, because it is going just over here, these three muscles, you know it, right? These are, say, supraspinatus, infraspinatus, and the teres minor, right? Because another S is on the opposite side. True. This top one, yes, we said completely dedicated to traps, right? And in traps, we were having descending fibers, transverse fibers, and the ascending fibers in that order, right? So here will be the descending fibers. These will be the transverse fibers. And over here, last portion, that would be the ascending fibers. How about this, right? This one, that would be the lateral head, right? Here it is, the lateral head, triceps. And since long we were talking about that there is medial head, but we never had a chance to do the darshan of this medial head. Now this medial head is coming up, right? And it will be having its great presence when we'll be discussing the arm. But here is the attachment of this medial head. Okay, so here is the medial head of triceps, right? Medial head of triceps. So that's how they both form. And yes, that's our today's guest of honor. That is brachialis, right? And above that, you can see that thin blue color line. That is none other than but the deltoid. Okay, so done. Yeah, this is all good. Well. On the medial side, right over here, there would be obviously the rhomboids, right? Rhomboids, major and minor. And on the top, there would be lev scap, right? Levator scapulae. And this one, that is clavicular head of sternocleidomastoid. Sternocleidomastoid muscle, right? Another different angle, right? So that things are completely clear in your mind. So easy things first, supraspinatus, infraspinatus. Now we can see even this portion very nicely, right? So that is all the way that traps, right? Starting from like descending, transverse, and ascending fibers. True. These three groups, right, we'll just write it supraspinatus, infraspinatus, and teres minor. Sorry. Good. Over here, this is the lateral, and this one is the medial head of triceps. That's very nice. And say gracefully, we can see. So this is the sternocleidomastoid and the clavicular head, right? And yes, here it is. See this just at the tip, just at the superior angle, right? If we really want to describe it, right, we'll say that at the superior angle, we have the levator scapulae, right? Levator scapulae, and underneath there will be rhomboidus minor and the rhomboidus major. Good. Suprascapular, infrascapular, but this time what is very nicely seen is, here it is, lev scap, right? Then just underneath is rhomboidus minor, and that's rhomb major. Correct? Rhomboidus major. And see, on the humerus, this is where lateral and the medial head of triceps. Good. Right. So done, right? This was for today, right? And see all these muscles, right? Just go through them properly, because next time we'll be starting with arm. Now arm will be having like a flexor compartment, a flexor and the extensor. What we'll do is, one day we'll take flexor, second day back to back we'll take the extensor. Now this will create the complete picture, that is all the way up to the elbow will be crystal clear, because it is the continuation of all these structures. As they go down, there will be only few, say, structures which will be emerging into that area, right? Regarding the forearm, yes, suddenly there would be an explosion, right? There'll be lots and lots of structure, but those structures, it's a great fun to remember, because then there are very interesting way to remember all of them. Once you'll know, you'll never ever forget it. Okay, so thank you so much, and we meet very soon. Right. Yes, I wanted to ask you one question regarding the general anatomy, right? General anatomy. Now, general anatomy is comprising of all those topics like, say, ossifications, then type of bones, and something which is not related to any one particular region. It is in general. So, do you wish to keep just maybe say 2 sessions for this general anatomy, right? Because it might not be very useful for senior students. They must be knowing it, right? But yeah, today we'll be meeting, there would be that motivation part, right? That is how to deal with distractions. We are meeting at 9 p.m. Yes, today we are meeting at 9 p.m. This change was only for this week. Otherwise, from the next week, once again, we'll be meeting at every Saturday. So I was asking about that regarding this general anatomy, right? There will be maybe 2 sessions, maybe 3, right? I don't know, right? Maybe 2 or 3 sessions, but let me know if you feel like that, yes, we should learn the general anatomy part also, then I can arrange for it. Right. Okay. All right. So thank you so much, and see you very soon. Sure. All right. Okay. Bye bye, and thank you.